Hello and welcome to this training video on some of the amazing three-dimensional dentistry content that is found on Primal Pictures. Primal Pictures has 3 different dentistry-specific topics that are found within the Clinical Specialty suite. And for today's tutorial video, I'm going to take you through real-time dentistry, which is where you can visualize all of the important structures of the head and neck with focus on the dentition and the tooth morphology. And using the 3D models in this real-time interface, you can perform a virtual dissection and you have a huge amount of flexibility and freedom with how you visualize the anatomy. So this is really great for taking a look at individual tooth morphology and simulating that dissection experience and learning anatomy in a 3D manner. That's where we'll start off, and then we'll move more towards the theoretical side. And I'm going to focus on the dentistry topic over here. And this is again where we'll have important 3D models relating to dentistry, but we'll also have some more application style content and theoretical content that relates specifically to the dentistry profession. Okay, but let's start off in real-time dentistry. And here we are in real-time dentistry. Just starting off with orientating ourselves. On the left-hand side, we have our menu. In the middle, you have the main viewing pane, or where you are going to find your 3D models. And this is essentially your virtual dissection table. And then on the right-hand side, there is a list of structures where you can create your own 3D model. Let's start off with the pre-made models in the menu, and those you can find at the second icon, the window frame icon. And at the moment, it's open up on a 3D model and in a diagram that shows the FDI dentition numbering system or notation system. But I'm going to close up that diagram, and you can scroll through all of these different 3D models and select what you are interested in, and it's going to show you all of the important anatomy relating to the head and neck. But we're going to stay, or rather keep our focus on dentistry specific anatomy or topics. And I'm going to open up the universal numbering system. For every 3D model, you have 5 different tissue depth options. I did select the 3rd tissue depth. It's the same 3D model that was the default model that opened up, but this time we have it next to a diagram that's showing the universal numbering system. You can change the size of this image using the icons above it, and the half-page option is really lovely so that you can visualize this entire diagram and your 3D model at the same time. You may have noticed that there are rollover labels for all of the visible structures or all of the anatomy. And if you select a tooth on the 3D model or on your numbering system diagram over here, it will highlight it on both, which is going to help you understand and cross-reference this numbering system according to how the teeth are situated within the maxilla and the mandible. Okay, and if we're done with this image, we could then close it up. And now let's focus more on this 3D model. So to rotate the model, I'm simply clicking down with my left cursor on my mouse and swiping along my screen. If I want to change its position on my screen, I click down the left and right cursor at the same time and swipe the model along. And then you can also zoom in and out by using the scroll function on your mouse. And now we can see these arteries, veins, and nerves in a huge amount of detail. You can select a structure simply by clicking on it and deselect it by clicking away. But you may want to learn about the theoretical knowledge behind these structures as you explore their morphology. And you can do that by selecting a structure and clicking on the text box in your menu. Here we're going to get all of that important theoretical information about structures. And you'll see that if I change what structure I select, the information in my text pane is going to change along with the change of what I'm selecting. Okay. Now let's focus on our inspection and dissection tools down here. I'm not going to go through all of them, but there are a few important ones. If you inspect a selected structure, it's going to isolate just that structure. And now I can take a look at the individual tooth morphology of my maxillary lateral incisor. If you deselect, inspect, you will go back to where you were. If you ghost a structure, it's going to turn that structure into X-ray mode, just like our mandible and maxilla are. But let's say we want a structure to go from X-ray mode back to solid. You'll select a structure and then come down and change it to solid. Okay, and then another important feature is the dissection feature or the hide button. So if you want to dissect a structure away, you can select it and click hide. Okay, so that's how you find the pre-made models over here. I've gone through how you can interact with them and engage with them and do a bit of a virtual dissection. But now let's clear this pane and very quickly, let's divert our attention to the list of structures. You can use this list of structures to add in individual pieces of anatomy one at a time. So I could add in all of my teeth at the same time if I wanted to, or I could add in individual teeth one at a time. Oh, there I clicked all of the mandibular teeth. Let's deselect those and just add in the canines. There I can do so. Okay, but let's add in all of the teeth and zoom out a little bit. We're a bit close to the smile over here. And let's add in our mandible and maxilla. There we go. Okay, our maxilla automatically added itself in X-ray mode to help us visualize the insertion of the roots of the teeth, but we can click those structures and select solid, and that's going to take them back to opaque. Okay, so that was a very quick example of how you can create your own 3D model, but let's divert our attention back to the rest of the menu. So after the pre-made models, we have the favorite icon. So this is where you can favorite 3D models, and that's really helpful if you have created a custom 3D model like I just did, and there I could then save it to easily revisit it at a later stage. There are a range of different settings available. I'm not going to go through all of them, but there is an important setting I'd like to show you. But to show you that, I'm going to change the 3D model that we're looking at. Let's go to a 3D model of the larynx and make sure that there are some arteries and veins. Okay, so now I have a nice 3D model of the larynx, and I'm going to come back down to my settings. An important setting is the cadaver color setting. Right now, this 3D model is color-coded, and it's really helping me see the difference between a vein, an artery, and a nerve using yellow, red, and blue color coding. But whether we like it or not, our cadavers and our patients aren't color-coded. So this is going to change the 3D model into cadaver colors and force me to think more critically about the difference between these vessels based on their anatomy and their landmarks and not based on a color. Okay, and then after that, there are a range of pinning and labeling and drawing tools which you could use to create a customized sort of study image or a customized labeled diagram. There's also a freestanding text box where you can add in whatever information you want. Okay, and you can move all of these labels and text boxes. And let's say I'm now happy and I've created a perfect study image. You can save a picture of this diagram using the camera icon. You could also share a link to what you are viewing or what you have created using the share link icon. And then lastly, these arrows are another way in which you can rotate or manipulate the model, but I do find it much easier to just use the mouse. Okay, but that brings us to the end of 3D real-time for dentistry. I really hope that this was helpful to you. Okay, and here I am back on my homepage, and next we are going to hop into the dentistry title. And here we are. Starting off again just with orientating ourselves. On the left-hand side is our menu, our middle pane is our main viewing pane, and on the right-hand side, this is our information pane. The first icon in the menu is where you can find different 3D models or 3D views. There are going to be a range of 3D models with all of the important head and neck anatomy, but I'm going to show you some of the 3D models that are particularly helpful to dentistry. And let's start over here with the cross-section of a molar. These 3D models work a little bit differently from the real-time title. You can rotate the model by simply clicking down and swiping along your screen, or you can click the left and right arrow keys. Then you can move between different preset layers of anatomy using the up and down arrows. So let's change our view a little bit over here, and you can explore the anatomy as you're changing it. So once again, there are those rollover labels for all of the visible structures. And if you select a structure, you will automatically get the explanatory information in your information pane. Okay, so I simply clicked down another layer, and I'm going to continue to do so until we can take a look at some of the internal anatomy of a molar tooth. Now I can visualize the pulp over here and again get the explanatory information about it. Okay, and you can also zoom in and out using the plus and minus arrows in the magnifying glass icons. I think another very important 3D model that we have over here, or 3D models, are the intraoral injections. So here we have a range of different nerve blocks available, and you're going to have a 3D model that shows you the important anatomy relating to that nerve block. So I rotated my model over there, and I'm going to start to move my way up through layers of anatomy. So here we have our syringe, and it's going to give you some important information about local anesthetic. And then we can add in some of the more superficial anatomy, which is going to help us understand the injection site for this type of nerve block. And there it is showing us the areas which will be affected by this type of nerve block. All right, then after our 3D models, moving back to our menu on the left-hand side, there are some MRI images of the head and neck, and these MRI images are shown alongside a 3D model, which is going to help you cross-reference what's happening in the MRI image and help you interpret and understand the anatomy. After that, there are a range of 2D slides or images. There are anatomy illustrations, clinical slides, dissection slides, and still MRI slides. A lot of these are labeled diagrams, and these are really great to save and insert into your study notes. Here is a brief example showing the distribution of the trigeminal nerve. And later on, I will show you how to save any content to use offline or insert into your study notes. Okay, so that was a quick look at the anatomy illustrations. I do also recommend that you take a look at the other 2D images or slides. But after that collection of information, we have some movies. These are going to take you through biomechanics of the head and neck, so how different muscles and bones are involved in achieving the movements that our head and neck is capable of achieving. These have been made so that it's easy to download them and use them offline, either in PowerPoint or Word in your study notes. These are surface anatomy videos, which are going to show you the surface anatomy of some of the important movements that our body can do. And here we have movement animations, again, which have been made specifically for export for offline use, and this is again focusing on the biomechanics and how different muscles and bones are involved in different movements. Here we can see some of those animations live in a flexible way where you can pause and play the animation at any stage. The first time it plays, it will buffer a little bit, after which it runs smoothly. So these versions have to be used online because they are interactive and you can manipulate the animation and take a look at the information pertaining to different structures. So this is great for online interaction, but if you're wanting to save this to use it offline, that is where these lovely movies come into play, which you can save for offline use. Okay, and then we get into some of the important theoretical information relating to dentistry. So here's where you'll find all of that wonderful information. I've selected teeth, and if I click incisors, I will get important information about the incisors or the canines as an example. There's also some patient examination information. So here we have some information on how to perform different oral examinations. So a whole range of theoretical information over here that I'm not going to go through. I'm not going to go through all of it, but just know that this is here to help you understand some of that important information. Okay, and then after that, here we have, again, some 3D models, but these take a more structural approach instead of a bit of a regional approach, which is what this first icon does. Okay, so these two icons that I'm toggling between, these both host 3D models, but just collected or curated in different ways. This is an alphabetical index, which is a way in which you can look for specific structures or pieces of information, but you could also use the search bar to search for any specific structure. Okay, and then once again, you can favorite any information. It did just prompt me to log into my personal profile. If I am not logged into a personal profile, all favorited content will be stored to the device that I'm using. But if I am logged into my personal profile, all favorited content will be stored to the cloud, which means I can access those favorites on any device. Then you can share a link to anything you have open up in your main viewing pane. You don't need to worry about the embed function. This is to put information on a website. But very importantly, there is the download function to use content offline or insert into your own study notes. So you can save an image of anything you're looking at. If I was looking at this 3D model of the head and I clicked save, I would save an image of this. If I was looking at one of these movies and I came to click download, I could save that movie. Okay, so your download option will always change according to what you are looking at in your main viewing pane. And lastly, there are some settings that you can change according to your personal preferences. But that brings us to the end of this dentistry title. That being said, we are now at the end of this video tutorial. I really hope that this has been helpful to you and that it gets you excited about learning anatomy, and specifically anatomy that's relevant to the dentistry profession. I hope you enjoy exploring Primal Pictures and anatomy in a 3D manner, and I wish you all the best for your future studies.